Feeling nauseated after bariatric surgery? You're definitely not alone. I'm Dr. Barr, a bariatric surgeon in Dallas, Texas, and mild to moderate nausea is one of the most common side effects during the first few weeks following surgery. Causes of this can range from very safe to kind of scary, so let's talk about why it can happen and what to do to feel better faster. So first off, why does it happen? During surgery, we cut, staple, or sew on the stomach. The nerves in that area's main job before surgery was to let you know that whatever you just put in your stomach was either too much or wasn't good for you and needs to get out fast. It makes sense that swelling and inflammation in this area can make those nerves angry, and you can experience this as nausea. The next cause is all the things your body goes through during and immediately after surgery. These are things like anesthesia, painkillers, and hormonal changes from the stress of surgery. These all carry the very well-known and common side effect of nausea. And that's why anti-nausea medication is pretty standard as part of the post-op cocktail that doctors anticipate you'll need. A little further out from surgery, there's a learning curve for what things can make you nauseated, and it's pretty different for every person. This can be things like eating or drinking too quickly or too much at once while you learn your new fullness cues. Food intolerances, especially dense proteins early on, or even dehydration or electrolyte imbalances, can form this loop that reinforces those signals in the brain, making it even harder to fix. So now how do we fix it? Some things, of course, can't be changed. You have to have anesthesia to get surgery. But if you have a history of bad nausea during surgery, you can talk to your doctor and let them know so they can adjust your anesthesia meds accordingly. We also have to cut on the stomach. That's kind of the entire point. So anticipating that this is normal and having some meds on hand can be very helpful. Last is making sure that you don't get into the nausea feedback loop. This means eating and drinking slowly, learning to recognize when you're full, which may feel different than before surgery, and also making sure that you stay hydrated and on top of your vitamins. Think slow and steady. Your stomach needs time to heal. Rushing food and fluids in one sitting is one of the biggest triggers for nausea early on. Finally, try to remember that nausea is usually temporary and it doesn't mean surgery has failed. But if it's not getting better and keeping you from progressing, you need to talk to your doctor to make sure you're getting treatment. Remember to like and follow for all things bariatric surgery, and if you're looking for a surgeon in Dallas, you can see us at DFW Bariatric and General Surgery.